and welcome to Essential Ingredients and our special limited series on changes. It's a very special series that gives us an opportunity to speak with experts and navigate us through menopause. So many women go through menopause and have challenges, and this is an opportunity to hear from a doctor that's dealing with this in an integrative way, as well as other founders that have innovated in the space to create other foods that can help us better deal with these symptoms, make us live that happy, fulfilled life, feeling good. So I invite you to join us and listen to our series as we move forward. So welcome to Essential Ingredients. I'm your host, Justine Reichman. With me today is Anjali Dsouza. She is a leading expert in integrative medicine. Thank you so much for joining us today.
I'm so excited to be here, Justine. This is going to be a great conversation.
I'm super excited too. I would say, today's conversation is part of a limited series that we're doing on menopause. And so as I've reached the middle age and I hit 52, I often hear people say that that's like the average time when people go through menopause. Now, for me, I personally don't know that because as I started to tell you, I've been on the pill for 100 years because I was useless for the month. The week before, I was nauseous and tired and cranky. The week of, oh my God, I'm so tired. I don't feel well. And it's like icky. And then the week after, I'm still tired. So 3 weeks out of the month, like non-functioning. That's not useful. But
No.
I went on birth control years ago. And I went on and off throughout, my life, but it really made such a huge difference. But the reason I share that is because today, whereas we talk about menopause, I'm going to be coming off of the pill.
Yeah.
As we decided we were going to do this around 52 so we could figure it out and then do some hormone replacement and all sorts of things so that I don't, suffer
So you
with
continue
some
to
of
feel
the
amazing. Yes.
Exactly. So, one of the inspirations is because I'm not alone in this journey, and we've had a variety of other folks come on to talk about products that they've made with different ingredients that have helped minimize some of the symptoms. I'm excited to have you on to really talk about it from a medical perspective as well and hear what you're thinking in this time and, what some of the resources are that we can all tap into. So, as a leading expert in integrative medicine and, as it relates to menopause, we'd love to get started talking and just hear what inspired you to go down this path.
So I will start by saying that I've always loved the underdog in medicine, always. So that married with my kind of interest in more holistic care that started as a young kid, I have just sought out additional training to be able to really provide people with care, especially when they can't get what they need from the conventional medical model. And that could be menopause and generally women, right? That could also be people with lots of chronic conditions who, maybe are not getting what they need out of conventional medical care and a whole host of other things. But menopause, I think specifically, has been an area in women's health that even, OBGYNs will share that they never really received proper menopause training. And so I went kind of out of my way to study this and become certified in menopause care to be able to support women. Because in fact, it's not just a time where maybe you feel bad. It's a time where there is a significant change in your physiology that has a lot of connection to pretty serious medical things, whether it's cardiovascular disease or diabetes or Alzheimer's disease or osteoporosis. These are things that actually, put a lot of weight on the quality of life and even the morbidity and mortality for women. And so we need to know what we're doing so that we can support women feel their best and live long lives, right? Feeling well.
I couldn't agree more. And one of the things that comes to mind as you're talking about this and you're saying you did some extra training, I'm wondering, okay, so what is this extra training? Because, I'm always curious and I always want to dig deeper, right? And, when there's certain things that are more interesting, you want to see where you can find the resources to be able to get it and understand that it's vetted, right? So I'm curious, can you share with us a little bit about that extra training and where you went to find it and how you decided that was the right training to get to make you the expert that you are today?
No, yeah. Well, hopefully I made the right choices, but but a couple of things. Like since I have more of an integrative medicine practice, like I sought out an integrative medicine fellowship and received a board certification in integrative medicine, which is, board certified doctors are kind of like the standard that we have in America, at least, of being able to understand there is some rigor in the training. There is some standards of like what kind of like education these doctors need to stay with. And so I first did that to kind of, give me tools more holistic, which, for your audience, there's a lot in the nutrition and food as medicine category that women can really be thinking about to support their health. And then I went on to seek out the Menopause Society, which was, previous called the North American Menopause Society, which is really one of the main kind of governing bodies or bodies in America that provide menopause education for clinicians and resources for non-clinicians that are looking to find, oh, is there a clinician that has studied menopause that could help me with this specifically, where, people that are listening to this podcast or otherwise could go and find. And I would say I chose them based on, the rigor and the notoriety that they have, and then sought out to kind of study and complete their certifications to be able to feel confident myself that I was providing good care for people.
Thank you for sharing that. I mean, for me, it really does sort of round it out and says, because so many times you go to, a doctor or you go to go find that resource and that expert, and you're wondering, okay, so how did you become an expert in this, right? I mean, especially when we talk about food as medicine, because so often I hear from doctors that they get like 4 hours worth of nutritional training and they're like, you really need to go see a dietitian or something, right? So here we are talking about food as medicine. So I think it's really important to acknowledge that you specifically went to go learn more about these things to be able to help people. And it's not just life experience with patients, but it's that coupled with that additional training. So that's really, I think, for me, when I'm looking to talk to somebody, whether a doctor or a resource, one of the things I really like to do is figure out and vet their experience the best way I can, because, we get so much information. And as lay people, how do we know? How do we make that? You don't. So let's talk about menopause a little and, what you've been seeing. Are there any trends that you can share with us around age and what to expect before we get into how to tap into resources and, so we can do things to make ourselves feel well?
Yeah, and if I may kind of answer your question, but maybe take us on a tiny detour to just like
Sure.
explain. Yeah, okay. So, when we are born as females, we have about 1 to 2 million eggs that we have that one day could be fertilized and turned into babies, right? And there's a ramp up process to get that whole system working. The brain starts talking to the ovaries somewhere around 8 years old, but it like takes years to crank that system up, right? Until it's working. And I just want to name to normalize this that as it cranks up, it also cranks down. And that whole journey of cranking down perimenopause into menopause is the other side of the same spectrum, right? It's this beautiful kind of like blossoming and changing into a different kind of flower. And I think it's useful to name that because sometimes it can help people understand like, no, you're not just feeling like crap when this happens. It's because there's a different physiology that's changing and shifting into a different gear for the next, whatever, 20 to 50 years of your life, whatever that may be. Um, and, I would say that what I most commonly see is people early in perimenopause that come in saying, actually, maybe what got you to go on birth control? I don't know. But I am, I'm super irritable. I have brain fog. My actual menstruation is a gong show. It's super heavy or super painful. There's just stuff happening. And it's not to say that our periods are without any discomfort, but the degree of discomfort is just so great, right? And then that can kind of just continue as you get to the definition is once you've had 1 year without a period, you're in menopause, right?
Interesting. Okay. That's why I don't know.
Yes. Well, I was thinking about that when you were saying like, well, I'm on birth control, and I'm like, for all we know, you may actually be in menopause, right?
It's true. Is that a bad thing to
I
be
mean,
on
it
birth
depends.
control?
Yeah, it depends. I mean, I think I would never say it's a bad thing. And my philosophy in medicine is that everything is individualized and everything is risk benefit for that person in front of you. It sounds like you had a great deal of suffering and you chose the birth control pill to like help manage that discomfort, those symptoms that you were dealing with. If I had the chance to have met you 7, 10 years ago, I might have like explored if you wanted to look at a different avenue, but it also may be protected against pregnancy, which was something that could have been important to you or anybody who's like looking at options out there, right? So it's not good or bad. It's more like what is going to work for your body. I think the curious thing is that when you're on birth control in your early 50s, given the average age of menopause is like you said, around 51, 52, then it's kind of like, I have no idea. Like, are you in menopause? Are there things that we would have known that were starting to shift if that birth control wasn't on there? Yeah, so that may be something that you'll be able to explore once you get off of it.
That I really, sharing that, I can imagine for me, for so many others, is really pivotal because I'm thinking about all these different experiences that I had. My lower hip and glutes have been hurting me for 10 years.
Yeah.
I don't know if the phone is listening to us, but I keep getting ads for hip pain and how it connects to menopause. I'm not sure. I meant to remember what the name is of what they keep saying, but I'm like, somebody is listening to me here.
I mean, yes,
Complain about my hip and my lower back and then my neck. And
well,
anyway, so, I'm curious as we
yeah.
dive into this a little bit more to understand what some of the things are that people can see during that time. Because I was on the pill, and as you said, I might have missed things that might have been connected. So
Mhm.
this glute and this hip pain, could that have been related? Could it still be related?
It's possible. Yeah, when you've got birth control on board, you kind of have like a steady state of hormones that are present. So, it's hard to know what's what, but yes, absolutely. You were still overall probably dealing with declining estrogen levels. And to just kind of frame this, we've got more than 400 receptors for estrogen all over our body, whether that's musculoskeletal or skin or heart or brain. So, people, I think, classically think of hot flashes as like a very menopausal symptom. And in fact, it is. But there is, I mean, that's like the tip of the iceberg, Justine. So, sleep changes, mood changes, cognitive changes, depression. Interestingly, like you're 14 times at higher risk to have a mood episode in the 2 years prior to menopause than the entirety of your life before then. And that's even if you've never had depression before. So it's pretty significant, right? Obviously, hair can change. People will notice a thinning, a drying, a dropping of hair, skin changes, which can be acne, but also dry skin. Body composition changes. So we change from kind of more this like subcutaneous fat to a more inflammatory kind of fat called visceral fat as we move towards menopause. And then our cardiovascular risk goes up, our risk for things like, oh, there's a,
I kind of like that.
there.
Looks like you're having a party.
I know. I did a thumbs up and suddenly there were like fireworks everywhere.
Well, let's
Metabolic
just clue
health.
everyone in. Like, wait, hold on. Let's clue everyone in for those that are listening to the podcast and not watching the video cast.
Fair. I
Anjali
just
just
had an
had fireworks
explosion.
behind
Yeah,
you.
explosion of fireworks with what I said. So I think I said cardiovascular and metabolic. So things like diabetes your risk goes up, and so does just weight gain generally. And then there's a whole spectrum of musculoskeletal things. So joint discomfort actually increases in arthritis and actual kind of rheumatoid like diseases related to musculoskeletal health. And then very specific kind of vaginal vulvar changes. So vaginal dryness, pain with intercourse, it's a whole host of things that can change. And I don't want to be doom and gloom. It's more like just be aware that those are things that may change. And most importantly, like go and talk to someone, right? Like this is hopefully an invitation for advocacy.
Yeah, and you mentioned also, I think, osteoporosis. Was that
Mhm.
something
Yes,
that
I didn't say that on my list, but that's a big one.
I think you did say it before, though. You didn't say it now, but you
Good.
said it before.
Good.
So I'm wondering, is that something that, comes up as it
Mhm.
relates to perimenopause to be an indicator almost? Is that an
Mhm.
indicator of something is, changing?
Well, there's an interacting sensitivity there. So, just as a function of us losing estrogen, we are kind of naturally losing the ability to stimulate bone and muscle. And so, this is related to some of those changes you see in the body that happens as you get there. As we literally lose estrogen when we're in menopause, we no longer have the protective effect of estrogen, which tends to really like support bones and give bones that extra oomph. So, is menopause causing osteoporosis? Not necessarily. There are certain people that are more at risk, but it's certainly that the loss of estrogen is going to put you at higher risk. So you'll see a higher incidence of osteopenia or osteoporosis as you move past menopause.
I'm so glad that you brought this up because I think that, I've heard so often it's the hot flashes or it's, being temperature sensitive or something like that. And there's all these other things that could just be indicators or red flags or just something to give you a moment to pause and be like, let me look into this further. So if we did that today for anybody listening, that to me is a great win. It's a huge win, right? So, since you said we were getting a little doom and gloom, I want to recognize that we do have, some exciting things here to talk about too, as you started to bring up the idea of food as medicine and the impact that can have. So, I'd love for you, if you could, to just talk a little bit about kind of what that looks like and what that means for people as they are either in perimenopause or menopause and the impact that they can expect to see. And of course, everything is individualized and people will respond differently to things. But even just to start the conversation to say, here's a couple things to try and the impact they can expect.
Yeah, well, so, just to frame again, like as someone who practices more integrative and functional medicine, like food is at the center of everything, right? It's literally the first message that your body gets. It is a biochemical message that your body will respond to. Eat a bunch of French fries, like that's an inflammatory message. That's going to have a certain impact on your body. So when we kind of like just narrow this down into perimenopause and menopause, like some of the recommendations are going to be standard, like that I would give anybody that's like trying to live a wholesome, long life, right? But there are some nuanced things. So, like I mentioned before, I mean, there is this change metabolically that's happening where we are less able to handle sugar, caffeine, alcohol, and this is going to have impacts that will increase the symptomatology that we experience during perimenopause and menopause.
When you're talking about the impact of sugar and how people respond to it, are you talking about refined sugar or even sugar in fruits and those kinds of foods?
And thank you for the distinction. I would say primarily refined sugar, although there are a subset of women that become so like glucose intolerant and it really affects how they feel in perimenopause and menopause that actually lowering their overall even complex carbohydrate load helps them feel better, interestingly enough. Now there's no limit to vegetables ever, right? So
Right.
always plant forward, always, but it might be that, if you could have a croissant every morning for breakfast, then in perimenopause and menopause, like that is more like a fun thing that you do every once in a while versus your morning routine, right?
Mhm.
Obviously, that's more refined, but even thinking like a whole grain pasta or a brown rice, it may just not work as well for you as it used to. So there are just things that you may have to pivot around nutritionally. I find that the carbohydrates tend to be one area. And then the other area is interestingly, if you're trying to really help yourself maintain body composition, keep your bones as strong as possible, support brain fog. These are all things that can come up. That really a protein forward approach is very important, right? So, you might have been able to get away with less protein in your earlier years, but as you move into this time, somewhere in your 40s, for most women, getting around 30 grams of protein 3 times a day to hit around 90 to 100 grams a day is actually really beneficial.
I eat a lot of protein, and I'm wondering, I love protein. Like, it is, I wake up and I eat leftover steak for breakfast, or leftover chicken, or leftover fish, whatever it is, because I'm so intolerant to so many things like eggs and gluten and etc. So to me, that's how I feel my best, right? But I'm curious, that's a function of how I feel, and I'm very attuned to what I eat. How might you recommend for other people to figure that out for themselves, since no two people are the same and not everybody is quite that in tune with, okay, I ate 4 strawberries, I shouldn't eat any more because I really do get a stomach ache from that?
I think some people are naturally more in tune with their bodies than others, right? They just naturally have a very visceral sense of this makes me feel 1 degree more tired than this template, right? And that's awesome if you have that. And people that don't can train it, but we are also busy, and like that's not always high on the training list for people. So I think in those individuals, it's really like feeling bad enough is what motivates them, right? Like as a clinician, I can say, like, I often will recommend, like, well, just at baseline, I think this would be best to do. And they'll be like, I don't think that makes a difference. Okay, great. But once they feel bad enough, they like come back and be like, what was that thing you said to do again? I'm willing to try it. And most of the time, I would say 90% of the time, Justine, they notice it once they feel bad enough, right? They start paying attention and are like, oh no, you know what? That was remarkable, the difference.
What's the window that people need to stick to something at minimum to be able to see the impact? When are people giving up too quickly?
Yeah, great question. So for food sensitivity stuff, it's the minimum is 21 days if you look in the medical literature. So I typically round that up to if you can at least stick with something for 1 month. After 1 month, if you really don't notice a difference, then fair. Maybe it's not going to make a big difference. I have seen, though, if I'm being honest, that people with significant chronicity to their symptoms do need to wait longer. Sometimes it's more like 3 or 6 months. But if we're going for averages here and, like what's going to hit the bell curve for most people, probably 30 days.
Okay, so if we wanted to give people a couple tips to start with, to kick this off, right? To say, okay, I think I'm in perimenopause or I'm going into menopause, and I get, I'm getting really bad hot flashes or joint pain or whatever their symptoms are. What are
Yep.
maybe 3 things that you could recommend that they could try
Yep.
to deal with these things from a food perspective?
Yeah, absolutely. So definitely the protein forward would be one, right? So just getting as much protein as you can, but around that 30 grams 3 times a day would be really important. I think the other thing would be, depending on how nerdy you want to get about it, figure out how to balance your blood sugar. So, some people will actually put on a continuous glucose monitor and figure out in that very individualized way, like what food works for my body best, which is awesome. But if you're not going to do that, then just do an experiment of saying, like, I'm definitely going to remove the refined carbohydrates for now. I find that some people do, like you did, but maybe for different reasons, better without gluten, right? And better without grains, generally speaking. But if we're starting again with simple, take out the refined carbs, take out any cola, take out any juices, like anything that has a quick glucose rise, just say goodbye, right? Or make the choice. Like I'm going to do this.
And when you say juices, are we talking green and fruit?
So even green juices can have a little bit of a glucose spike for people, but I would certainly say definitely fruit juices and colas, right? If there are some green juices that are totally fine, and we could do a whole deep dive on which one is good and which one maybe is not, and which person does it depend on, and it's probably too nuanced for this conversation. But But I think in general, grain juices are probably fine. So yeah, the glucose angle, the protein angle, and then the last thing would be figure out how much you really want alcohol. Because this is the time of life where you're going to have to make a choice on like, are you going to feel okay or are you not going to feel okay? Are you going to sleep or are you not going to sleep? Are you going to be grumpy and irritable and feel depressed or are you not? And even though alcohol has that kind of more immediate, like positive impact, as we get older and as our hormones change and as our liver detoxification systems are not as robust, we just pay for it when we drink alcohol as we get older.
I think so. And I do have a question for you as it relates to alcohol, because my understanding, and I don't know if this is true, that men and women metabolize it different. And so it affects us and how, we feel more than it does them. Can you talk to me a little bit about that and how and specifically as it relates to menopause?
So I think there's two things happening there, just like capacity of filtration, right? So there's a different filtration capacity that a female has versus a male. And so there's going to be a lowered capacity, generally speaking. But I think what's also happening here is as our hormones are fluctuating, we are kind of, dealing with these changing, and we have to detoxify our hormones too, right? All of these hormones are moving through our liver as well. Cortisol, stress hormones, everything is moving. And so putting any stress on that system with alcohol is also going to have like ripple effects on the rest of our bodies, our hormones and other things that are much more vital to a woman than to a male, just because ours are always fluctuating versus a man that, like, for the most part has more of a steady state.
Okay. Thank you so much for all this information, for the conversation, for the inspiration to dig deeper for so many of our guests that, experience menopause. So if anybody wants to learn more about your integrative practice, where might they be able to find that information?
Yeah, so our practice is called District Center for Integrative Medicine. It's a little bit of a mouthful, but we are here in Washington, D.C. in the very heart of the city, and provide kind of more comprehensive care both for women, men, and all humans really that are looking for a more comprehensive approach to their care. I also have an Instagram handle where I do more specific kind of geared towards women health topics. And that's just my name. So ANJALIDSOUZAMD is the handle. And those are probably the best ways to find me. And my last little offering is kind of an online network for women, again, specifically to kind of come together and support each other. That maybe, you're not someone looking for like a full medical experience, but you want to like meet with a clinician who can give you guidance about like, what should I be eating or not? Hey, I saw this trend on TikTok that said I should be like washing my ears with iodine. I don't know, making this up. Should I do that? Right. It's just a place to like, it's just a place to have community and support. And I do educational series there as well. So for example, I'm going to do one on the reproductive years and how, your period is actually a vital sign that you should be thinking about coming up soon. I did one on menopause recently. It's a really lovely community.
Awesome. Thank you so much. Yeah. For those that are tuning in today and listening to the podcast, don't forget we also have the video cast on YouTube. And for those watching us on YouTube, don't forget we have the podcast wherever you listen to your podcast, iTunes, iHeartRadio, etc. And if you're not following us, make sure to follow us at essential.ingredients. Thank you again, Anjali, for joining us. It was such a great conversation.
It was so fun to chat with you, Justine. Have a lovely day.
Likewise. Thank you.